Hello, everyone. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester, board certified pediatrician, independent health advocate, and CEO of Your GPS Doc. Well, here we are again. It is Monday night, 8 o'clock p.m. Eastern Standard Time. So it is time for our weekly episode of Navigator Nuggets. Thank you to all of you who will join this live. Drop a comment. Let me know that you're here. Say hello. Thanks to all of you in advance who will catch the replay. As you all know, for the entire month of March and now headed into April, we have been talking about the coronavirus pandemic, and we are going to continue to talk about the coronavirus pandemic. Today, though, I'm switching it up just a little bit. And I want to address something that I have seen and heard and gotten a lot of emails and phone calls, and that's related to health insurance. Hey, Adrienne, thanks for tuning in. So as you all know, this coronavirus pandemic is far-reaching, and while the biggest concern, of course, is our health and the health of our friends and family members, the other significant impact that this pandemic has had on our country and really across the world is the economy. And so I'm sure that you all are aware that, millions of Americans have lost their jobs as a result of the, shelter in place orders and all the other things that have been appropriately put in place to keep us in our homes so that we can flatten the curve. But as a result of that, many businesses have either scaled back, some have closed, some have been forced to close because they're not considered essential. And so as a result of all of these activities, many people have found themselves unemployed. And, if you receive your health insurance through your job, then being laid off as a result of the coronavirus pandemic means that you no longer have health insurance. So not only are you dealing with the challenges of not having an income and trying to figure out how you're going to continue to provide for yourself and your family, but now on top of all of that, you are without health insurance at a time when, God forbid, we don't want anybody to be without health insurance. Because can you imagine the double impact of being unemployed, having limited income, and potentially being sick with either coronavirus or anything else? People are still having heart attacks and strokes and things of that nature. And so many of you have reached out to me with questions about what to do. And so I wanted to really talk mostly on this episode about that. So if you have friends and family members who have been laid off or whose hours have been cut dramatically, who are at risk of losing their health insurance or already have, please tag them in this video. Please share this video, because as always, my goal is to get this information to as many people as possible. If you have missed the previous episodes of Navigator Nuggets devoted to coronavirus, I think there have been maybe 5 of them so far, then please go to my YouTube channel. And in fact, you guys, if you're not already a subscriber, please go ahead and subscribe to my YouTube channel. I'll drop the link in the comments later, but it's bit.ly/YouTube GPS Doc. Okay, bit.ly/YouTube GPS Doc. All right, so let me start as always by providing a few statistics related to coronavirus. So I am using the Johns Hopkins website, the map that they created. This is what they show on CNN, and this really has been the most reliable source for updated information regarding coronavirus cases, not just in the US, but across the world. So unfortunately, and I don't remember what the numbers were last week, but this continues to exponentially rise. So as of today, right now, 8 o'clock p.m. Eastern Standard Time on, what's today, April 5th, the total number globally is 1,345,048. I know we were not at 1 million last week. And last week I did it on Tuesday, so it hasn't even been 7 days. So that's globally 74,565 deaths, 276,515 have recovered. So again, I'm thanking God for that. We are still, and that number continues to rise. And in the U.S., as of right now, 366,614 cases, 10,783 deaths, and 19,581 have recovered. Okay, so those are the current statistics. So let's go ahead and hop into the health insurance issue. So if you are watching, or if you know someone who has lost their job as a result of the coronavirus pandemic, or honestly, even if they've lost their job for other reasons, I just want to make you all aware of the options that are available. I don't want anyone to think that you have no options and that, you just aren't going to have any health insurance, because there are options available. Okay. So the first option that anyone who has recently lost their job should look into is the Obamacare or Affordable Care Act. Okay. And so thank goodness, due to the Affordable Care Act, there are many options for individuals who are uninsured. And in fact, what happens, so the open enrollment period for the Affordable Care Act health plans ended back in December, but there are special enrollment periods. And one of the things that qualifies you for a special enrollment period is loss of a job. And that can be whether you were terminated or whether you resign. Basically, if you lose your income, if you lose your job and you had insurance through that job, then you are eligible for a special open enrollment period. So for those of you who may be in that situation, you have 60 days from the date that you were let go from your job to apply for a health insurance plan through the Affordable Care Act. So again, 60 days. This is not unlimited. Now, as a quick aside, in addition to that, many states, including my home state of Maryland, even prior to the huge layoffs and things like that, they decided to open up a special enrollment period specifically to try to get people insured during this pandemic. Because as you all know, this has been a huge strain on our healthcare system. And so we want to minimize that by having as many people insured as possible. But B, and more importantly, we want to make sure that people are not avoiding seeking health care because of the fact that they don't have insurance. So Maryland, I think DC, and at least maybe 3 or 4 other states had already enacted special enrollment periods during the pandemic season. And on top of that, like I said, if you have recently lost your health insurance coverage because of a loss of a job, you have 60 days to apply through a special enrollment period for an ACA plan. So you may be wondering, how do I do that? So all you need to do is go to www.healthcare.gov. It's going to ask you for a little bit of information. It's going to start with your zip code, and then it's going to take you to the appropriate site. For some of you, depending on what state you live in, you will see the options for health insurance on the healthcare.gov site. For others of you, like those of you who may live in Maryland, like myself, it will redirect you to a special website that's dedicated to Maryland. In Maryland, it's the Maryland Health Connection. All right. So, and then just follow those instructions. It's going to ask you for some demographic information, your name, and it's going to ask you about your household and your income. And you want to put your income as it is today, not what you were making before you got laid off, not what you made last year, on your tax return, but what you are making now. And this is very important because the next option that I'm going to talk about is Medicaid, and we'll get to that in a moment. So just follow the steps. It's very user friendly. There's a phone number on the website if you are having difficulty. I think that they have reduced the hours for that help, but you should be able to get someone on the phone and they can help you. But like I said, the website is very user friendly. And as you enter information about yourself, it is automatically going to let you know whether you qualify for subsidies. Because your next question may be like, Dr. Nicole, you're telling me to go apply for health insurance at a time when I just lost my job. Nobody has money for that. But the thing is, the Affordable Care Act has subsidies where you can get a reduced premium, which is the amount of money that you pay every month Also, depending on your income, you may qualify for other subsidies where they will reduce your out-of-pocket expenses. So they will reduce your deductible, reduce your copay, your co-insurance. The only way you know whether you will qualify for those things is to actually go and apply. You're not bound by anything until you hit that last submit and agree button, but you can go on the site, you can browse the plans that are offered in your county. And then, like I said, by putting in your demographic information, you will see what help, if any, you qualify for. Okay, so that's the first thing you need to do is go to healthcare.gov and shop the ACA plans. Now, the other option is Medicaid. So Medicaid, unlike Medicare, which is often confused with, Medicaid is a sponsored health insurance plan for low-income individuals. So this is a jointly sponsored plan. It's covered by both your state government and the federal government. And its purpose really is to provide health insurance for low income. So now there are some states that have expanded Medicaid under the Affordable Care Act, and there are other states who have not. And the reason that's important is that in some states, you have to meet very specific criteria to qualify for Medicaid. Some of them, you may have to be a parent, or you may have to, be pregnant. And in other states like Maryland and many other states that have expanded Medicaid, you may just have to meet a certain income level. Well, if you've lost your job and your income is zero, or your household income has now been cut in half because only your spouse is working, then there's a very good chance that you may meet those income limits to qualify for Medicaid, okay? So very quickly, I'm gonna read to you the states that did not expand Medicaid. And even in those states, you may qualify, but that's Wyoming, South Dakota, Kansas, Missouri, Oklahoma, Texas, Wisconsin, Tennessee, Mississippi, Alabama, Georgia, South Carolina, North Carolina, and Florida. In those states, it may be a little trickier, but you still may qualify. And in the other states, for the most part, there's just a basic income limit, okay? So generally, you can find out whether you qualify for Medicaid by that same application process that we just talked about on the Affordable Care Act, healthcare.gov. You can also go to your state Medicaid's website, or you can call your state Medicaid office. And you can get all of this information on Google, okay? If you live in Georgia, type in Georgia Medicaid office. If you live in DC, type in, DC Medicaid office. And you can get the links and the phone numbers to those offices, okay? So you may qualify for Medicaid, and guess what? Medicaid is essentially, it's free. I mean, you don't pay a premium. In many cases, you don't have any out-of-pocket expenses, meaning, your copay, there are no copays, there are no deductibles, there's no co-insurance. And so again, I don't want those of you who have lost your jobs to sit and think that you have no options. And I would hate for you to be able to qualify for free health insurance or for really reduced health insurance through the ACA and not get it just because you were paralyzed out of fear and despair and all the other emotions that many of us are feeling right now. Okay, so that's the second option, is Medicaid. And then the third option is COBRA. Okay, so let me know if you guys have heard of COBRA. If you've heard of COBRA, type a 1 in the comments. And as a bonus, if you know what COBRA stands for, and don't cheat, don't go to Google, but if you know what COBRA actually stands for, then go ahead and type that in the comments. So this is the third option for individuals who have recently lost their health insurance because of a job loss. Okay, Uncle Dickie, he says he knows. Do you know what it stands for? Let me know if you know what it stands for. So Tiara knows. Excellent, excellent. So the thing with COBRA that I want to make sure you guys are aware of is that if you have lost your health insurance either through your loss of employment or through your spouse. So maybe you are still working, but maybe you work part-time and you don't have health insurance benefits. And maybe you are getting health insurance, or you were getting health insurance through your spouse, and now they were laid off. So you still qualify for COBRA. Okay, Uncle Dickie says, I don't remember. That's fine. I'll tell you guys in just a minute. So yes, so if for any reason, Adrian knows, excellent. If for any reason you lost your health insurance plan, whether it's to your lack of employment or your spouse, or maybe it's a parent even, then you all need to look into COBRA. All right, so COBRA stands for Consolidated Omnibus Budget Reconciliation Act. All right, you guys don't even need to know that. That was just a trivia question for tonight. But essentially what COBRA is it's a law that requires employers to continue to provide health insurance benefits to former employees, okay? So anytime you resign from a job, if you are laid off, this is one of the options. Good job, Tiara. Excellent. Excellent. Yes, Tiara got it right. So yeah, this allows you to continue to get health insurance benefits through your employer even after you have lost your job. However, there are some caveats to this. This applies to private employers, okay? So this does not apply to government. They have their own set of rules for things like this. So this applies to private sector employers, and they have to have at least 20 employees. So if they have at least 20 employees, they are bound by law to offer you COBRA. All right, there are some other caveats to COBRA. If you were fired due to gross misconduct, then that is an exception to COBRA. Otherwise, any other reasons that you left your job, or laid off, COBRA applies. Okay. Same thing if there was a reduction in hours. So maybe you were full time before the pandemic, and now your hours have been cut because the business isn't doing well, and because of that cut in hours, you've lost your health insurance benefits. You qualify for COBRA. Okay. All right. So under COBRA, similar to with the ACA special enrollment period, you have a limited amount of time, okay? You have 30 days. You must notify the insurance plan within 30 days of the qualifying event. And when we use terms like qualifying event, that means basically when you lost your job. So, and then you have 60 days to actually sign up for COBRA. So within 30 days, you have to let the insurance plan know that you are interested in doing COBRA. And then within 60 days, you have to actually sign up. Okay? Now, this is the thing. You have to have had health insurance the day prior to being let go. So if you didn't have health insurance already through your job and now you've been let go, then you don't qualify for COBRA. It only applies to people who were insured under the employer's group health insurance plan prior to, being let go. Okay. So again, you just had to have had the insurance one day prior to the qualifying event. All right. Now, the other thing with COBRA that you need to know is that unfortunately, COBRA can be very expensive. So this is probably not going to be a viable option for many, but I want to let you know that this is an option. And the reason it's expensive is because when you get insurance through your through your employer, they subsidize the cost of your premium, meaning they typically pay a significant amount, sometimes 50-60% of that monthly premium to the insurance company. And so what happens with COBRA is that the employer is no longer paying any of the premium. The entire premium is on you. So you may go from, maybe you were paying $100 every pay period, and now you may go to having to pay, $600 a month for that same plan. But it is an option if you can afford it. Okay. So the thing with COBRA is that, like I said, you have 30 days to let them know, 60 days to sign up. It is temporary. In most cases, including loss of job, this coverage lasts for a maximum of 18 months. Okay, so that's a full year and a half, and you are bound by COBRA unless you now qualify for a new health insurance plan. So you can't sign up for it and then 2 weeks in, you're like, forget this, I don't like this plan, or this is costing too much money. You're bound by that until you're in a position where you qualify for something else. So for example, if the next open enrollment period comes up for the ACA, or if you get a new job, or if your current job, increases your hours again and now you qualify for their health insurance plan, then your COBRA would basically be void and you could go back to another health insurance plan. Okay. The other reason you would lose COBRA is that if you fail to make a payment within 45 days of the due date, or if you are late for future payments, then they can terminate. So they can terminate your coverage based on non-payment. But other than that, this coverage is effective for up to a maximum of 18 months. Okay, so I wanted to make you all aware of those options. Let me make sure that I covered everything. And let me know if you all have any questions. Just go ahead and drop them in the comments. So again, just to briefly recap, there are three options. There are three options for individuals who have lost their health insurance coverage as a result of losing their job or their hours being reduced because of the coronavirus pandemic. Okay, and just to briefly review, we talked about the ACA. So go to www.healthcare.gov. Keep in mind that you easily may qualify for subsidies and reductions in your co-pays, co-insurance. You may even qualify for a plan that's free. So make sure that you do that if you are in a position where you have lost your health insurance. We also talked about Medicaid. Many of the states have expanded Medicaid, and simply based on your income or lack thereof, you may qualify for Medicaid, which generally has very little or no out-of-pocket expenses, okay, including premiums. And then we talked about COBRA, which is where you can continue to stay on the health insurance plan that you were previously receiving by your employer. For that, you need to contact your HR department for your employer and let them know that you're interested in COBRA, and they can send you the information to enroll. All right, so guys, hang in there. I know that this is very difficult for all of us. I continue to pray for all of you, for our health, for your health, for your safety, for you and that of your family members. Stay home, please. Stay home, stay home, stay home. That is the most important thing that we can do right now, is to practice physical distancing, is what I like to call it. You don't have to socially distance, physically distance. Stay connected to your friends and family members through, video calls, FaceTime, Skype, Zoom, all those things. Reach out, call people. You can make regular phone calls, check on the people, use this opportunity to, maybe reignite some relationships or renew some bonds, friendships that maybe you have allowed to kind of, drop by the wayside over the years. But know that I am praying for you. If you have specific questions about health insurance, if you are caring for a family member during this pandemic and you have concerns or questions, you can always book a complimentary consult call with me by going to calendly.com/yourgpsdoc. I'll put that link in the comments as well. And like I said, if you're not already a YouTube subscriber, if you haven't subscribed to my YouTube channel, go ahead and do that. bit.ly/YouTube GPS doc, and you can catch all of the previous episodes in this coronavirus series related to the Navigator Nuggets episodes. All right, you guys, if there aren't any questions, and I don't see any, I want to thank you again for tuning in to Navigator Nuggets. Again, my name is Dr. Nicole Rochester. I'm a board-certified pediatrician, independent health advocate, and the CEO of Your GPS Doc. I help family caregivers do three things: relieve overwhelm, buy back their time, and ensure that their family, their loved ones, receive appropriate and effective health care. All right, so thanks again. I will see you all next Monday at 8 o'clock p.m. Eastern Time. Until then, be safe and God bless.